Welcome to today's Explainer. We are jumping right into a massive shift that is happening right now in how households actually manage their medical expenses. Look, more and more people are just totally stepping away from the traditional corporate healthcare systems they've used for decades. They're actively looking for a completely different path to protect their families without breaking the bank, and the source material we're digging into today lays out exactly what that alternative path looks like.
So let's be real for a second. What if there was an actual, functional alternative to costly, traditional health insurance? So many people feel completely boxed in by the standard healthcare system. You might be feeling that exact financial stress right now, staring at those constantly rising premiums and feeling like you just don't have a choice if you want to keep your kids protected. But the really exciting news here is that there are alternatives, and a rapidly growing number of families are moving toward these predictable, budget-friendly coverage models to finally escape those massive corporate costs.
All right, here is our roadmap for today. We're going to cover the shift to alternatives, how health sharing works, everyday care with DPC, negotiating the big bills, and wrap up with important rules and limits.
Okay, Section 1, the shift to alternatives, moving away from corporate systems.
The source material paints a super stark contrast between these two worlds. Think about the old traditional system for a minute. It's for-profit, you're burdened with these incredibly high corporate premiums, super restrictive networks, and honestly, it often just feels like you're dealing with a cold, distant machine. Now compare that to the health-sharing alternative. It's nonprofit. Instead of premiums, you have predictable monthly shares. You actually have the freedom to choose your own doctor, and the whole thing is community-focused. It's basically just families looking out for each other.
Moving right along to Section 2, how health sharing works, a community-based approach.
Now, to really grasp how this model works, we need to define a crucial piece of terminology, the Member Responsibility Amount, or MRA. Basically, this is the set amount your family pays out of pocket for a specific medical event before the community begins sharing the eligible costs. Think of it like a threshold or a cap on your financial responsibility for a single incident. Once you hit that magic number, the community steps in and helps carry the rest of the load.
And because there is zero corporate profits to feed here, the data shows that monthly shares are often significantly lower than what you'd pay for full insurance premiums. That literally frees up your household budget for other things, like groceries, school, or building your savings. And here's the cool part. You choose your MRA. If you pick a higher MRA, your monthly share goes down. Once that's met, the community shares the cost for major events like hospital stays, surgeries, or maternity care. It acts as this incredible safety net, which is huge if you ever find yourself caught in a coverage gap or transitioning between jobs. Keep in mind, though, the whole foundation relies on members agreeing to maintain a generally healthy lifestyle, which is how they keep those costs so low for everybody.
So that covers the big, scary emergencies. But what about the day-to-day stuff? Section 3, Everyday Care with DPC, Rethinking the Family Doctor.
The game changer here is a concept called DPC, which stands for Direct Primary Care. This is a membership-based model that gives you direct access to a primary care physician, completely bypassing all that corporate insurance red tape. When you pair a health sharing program with DPC, you aren't just some random policy number anymore. You actually get back to having a real, genuine relationship with a doctor who knows your name, knows your kids, and knows your family's health history.
$35. I want to highlight this specific number because under this setup, everyday care becomes unbelievably transparent. Many of these programs allow routine visits. We're talking sometimes up to 6 visits a year for just $35 per member. So when a seasonal bug hits and takes down 2 or 3 of your kids at once, you know exactly what that visit is going to cost you. Zero hesitation, zero stress about hidden fees.
And this next point from the material is a massive relief. Virtual care is usually included with absolutely no extra consultation fee. We've all been there, right? It's 2 a.m., your kid wakes up with a crazy high fever, and the panic instantly sets in. Instead of throwing them in the car and rushing to get a wildly expensive emergency room bill, you can literally jump on a late-night video call with a doctor right from your couch at no extra cost. It is just such a sensible, modern way to look after your family.
But of course, we have to ask, what happens when a massive hospital bill arrives in the mail? Section 4, Negotiating the Big Bills, Tackling High Hospital Costs.
Let's pull back the curtain on how this system protects you on the back end. When you have a major medical event, Step 1, the nonprofit group receives the hospital bill directly. Step 2, their dedicated negotiation team steps in, contacts the provider, and asks for a fair, self-paid price. Sometimes they even track down district funds to help. Step 3, a lower price is agreed upon because the program promises fast payment. And let me tell you, providers absolutely love fast payment. Finally, step 4, that remaining, significantly lower cost is what actually gets shared by the community, and the provider agrees not to balance bill you for the difference. They literally fight to slash that sticker price before you even start sharing the cost.
I absolutely love this quote from our source material. It nails the whole philosophy perfectly. Instead of a threat, it becomes a problem someone else works to solve. Just think about the profound peace of mind that brings. When a massive bill arrives, you aren't fighting it alone. Experienced professionals are going to bat for you to lower the sticker price, saving you an incredible amount of money and, let's be honest, a whole lot of sleepless nights.
Now, as great as this sounds, every system has its parameters. Section 5, Important Rules and Limits, Transparency and Guidelines. It is absolutely vital to fully understand the fine print before you even think about joining.
If you're seriously considering this route, you have to be wide-eyed about the limitations. For instance, pre-existing conditions are often subject to phase limits or specific waiting periods. Maternity care? You usually have to be enrolled in the program before the pregnancy even begins, for those costs to be shared. And for active, high-cost chronic needs, honestly, traditional insurance might actually just be a better fit for you. Total transparency and honesty on your application are absolutely essential here, so you don't run into any nasty surprises down the road.
So the absolutely crucial takeaway here is that health sharing is a voluntary program. It is literally not state-regulated insurance. The rules follow the specific program's guidelines, not traditional insurance laws. Also, if you are over 65, you're likely going to need Medicare instead. This entire model requires you to be proactive. You've got to do your homework, use their network tools to verify that your current family doctor is actually in their nationwide network, and above all else, know your exact member responsibility amount and read every single detail of those plan guidelines thoroughly.
Which brings us to our final thought for today's explainer. Look at the facts, look at your family's budget, and ask yourself this. Does a nonprofit community model or traditional corporate system best serve your family's health and budget? The shift away from costly insurance is happening right now, and the tools are definitely out there for you to confidently explore these alternatives for your own household. Thank you so much for joining me to unpack this source material today. I highly encourage you to look into these options. They might just be exactly what your family has been looking for.